So for the second part of conservative management of a rotator cuff injury or some kind of shoulder injury is largely focused on the course of care. So Zach, you touched a little bit earlier on what we would do for day one with how we would approach somebody, say they had trauma or didn't have trauma, some key points on screening and assessment, as well as your three different areas that we focused on that home program for that first session. But where do we go from there? What are some things that commonly pop up, and what are some things that we're focusing on as we take somebody through this plan of care?
Absolutely, and I think at this point it's typically understood that they may not be perfectly pain-free, but pain levels and symptomology should be at least very low level and at the minimum very predictable. So this allows us to move into more of our traditional rehab-oriented activities that we think of when we think about restoring mobility and strength. So at this point, we're talking about optimizing movement. We spent the last couple sessions maybe just getting them comfortable with movement, getting rid of that fear avoidance, trying to get them from point A to point B, just to get all of the range of motion they have. Now we need to make it look functional, make it relevant, and make it look good as well. So at this point, we're still hitting those same buckets. We don't really need to focus as much on the symptom relief, pain management bucket, but our mobility, what used to look like PT School 101 type activities, now it looks like your traditional stretches. So maybe we're getting them into like a side-lying open book. We're doing some overhead activities. Maybe we're getting them into different quadruped reaching activities. From a strength standpoint, we're probably doing things that start to look like a more traditional strength training program. We're doing different pressing and pulling variations. We're doing it probably with a more horizontal, an incline, or a vertical component. We're being mindful of if we're doing this from a bilateral or a unilateral position, and I think a lot of that tends to do with the individual at play. What's their movement profile? Are they somebody that's pretty well coordinated? Are they somebody that's pretty body aware and they can handle a variety of motions? Or is this somebody that we just need to simplify the task and we may be choosing some more of our just basic bilateral symmetrical activities? And when I say something like that, I'm talking about like an inverted row on the TRX, or maybe putting them at the end of the table or on where the bench press bar is and having them do push-ups there, as opposed to doing like a staggered stance Kaiser row or some of your more involved pressing variations. But I think at this point, we know now that their range of motion may not be perfect, their pain levels may not be perfect, but they're good enough to start getting into lower intensity, lower threshold training with the intent of in the future loading these activities and doing them with some more intent at a later date.
So when I'm hearing you, I'm thinking a little bit of some different benchmarks that you might see throughout the rehabilitation process. I'm thinking early on at isolated movements where we might potentially be doing things more targeted on rotator cuff. We might be introducing a little bit more of your standard push-pull, usually in a horizontal fashion first before going into vertical, and then getting to a point where we are going to do some of your more traditional weightlifting routines. Is that fair?
Absolutely, and all the stuff that you mentioned first in that more isolated fashion that we did day one, it doesn't mean that we're abandoning that, but we've probably transitioned that to either just doing it more as a home program, or maybe we're encouraging them to come in a little bit early and they're knocking out some of those more remedial tasks as part of their warm-up. So after they get on the bike or after they go do some of like their tennis ball self-MFR, they're running through some of these easier, more remedial tasks as prep work to get into the bulk of the session that we're going to spend our time with them during that 30 minutes of one-on-one time.
So taking that now, okay, we've got active range of motion. We've got the ability to generate tissue tolerance in various planes of motion. We're starting to introduce push, pull, and most likely probably some kind of carries as well, so that you get that distraction force. Then the word stability pops up. And stability, I think that we can look at that in two different ways with regards to open kinetic chain and closed kinetic chain. And just to clarify, the definition of stability is control in the presence of change. So I often think of, when I think of open kinetic chain, our kettlebell activities. It could be an arm bar. It could be a snapshot of a Turkish getup. We could be doing windmills. And then when I think of the closed kinetic change side of things, I think of a lot of our quadruped positions. Maybe we're talking down dogs. Maybe we're talking a little bit more of the sit outs or the break dancing type movements. But are there any other things that you would consider when working on quote unquote stability with shoulder?
The biggest thing that comes to mind with stability of the shoulder is just how many degrees of freedom the shoulder joint or the shoulder complex has. So I think what we need to be appreciative of is when we are talking about stability, it's stability across multiple environments, like you had just mentioned. Open chain versus closed chain. In what way is the force coming? Is it something with a slow onset or an immediate onset? Is it something with a high rate of force or a low rate of force? And then also, what is the direction? Is it primarily sagittal plane? Is there some sort of lateral or rotational component to it? So I find myself doing stability work typically either earlier on in the session, almost like in a rapid fire, kind of like circuit style as part of a dynamic warm-up, or we're just going from one position to another. Maybe we're doing some ground-based work where we're working in side planks to a high plank. We're working on lifting a hand, lifting an arm. From those positions, you can transition into more of your dynamic movements, like maybe a mountain climber or bringing a knee diagonally across to the hand, some of your kind of breakdance moves that you had talked about. So I think stability is really just that ability to be comfortable, confident, and competent in a variety of environments. So that way, when we're doing strength-related tasks later on with higher rates of force, higher rates of tempo and velocity, or when we get into our discharge criteria and we're looking at more of a chaotic or unpredictable environment, either in our work environment, our daily living, or a sporting environment, there's nothing that we haven't been at least subtly exposed to in a rehab course.